There's a lot of talk about T3 and T4, and there's a lot of push out there, mostly by inexperienced practitioners who insist that Armour thyroid or similar is better for you because it has T3 and T4 in it. So let's talk about what they are. T4, you can think of as a thyroid hormone that's your reservoir, okay? Most of it circulates around in the bloodstream. It's bound up on proteins, ready to be used when it's needed. The free T4 is the amount that can be used and converted into T3. T3 is the active form of thyroid hormone that each individual cell needs to do cell things. And it gets converted from T4 on demand. And the amount of T3 that you need is dependent on a lot of things. Like if you're really sick, you don't need very much T3 at all. If you're on certain medicines, it can block the amount of T3 that you get. Other medicines could enhance the amount of T3 that you get. So it's very dynamic and it can be a little bit tricky. So where does Armour come into this? Armour is ground up dehydrated hog thyroid tissue. And the thing about Armour is, number one, hogs need very different amounts of thyroid hormones than we do. The amount of T3 to T4 is way different than the human. So most people who are on Armour end up kind of over-treated with excess T3. There's also a lot of variability in Armour. These pills can, because they're taken from batches of hogs, literally at the slaughterhouse, there's nobody who's checking hog thyroids before they do that. So you can get batches of goiters or batches of high functioning hog or low functioning hog. And so there just can be differences from batch to batch. So again, humans just need a very different amount of physiological thyroid hormone, and it's important that we allow the body to regulate how much T3 it needs when it needs it.